Today, top COVID-19 officials testified in front of a U.S. Senate committee with some advice on what school may look like when it returns this fall. Among those who spoke was Dr. Anthony Fauci, and Christiane Cordero followed the hearing and joins us from the newsroom with where that discussion stands at this point. Christiane?
You know, Allie, it's really interesting because schools have to start planning for a wide variety of scenarios, and yet it's really hard to know where we will be here in Minnesota or as a nation in the next couple of months.
That it really will depend on the dynamics of the outbreak in the particular location where the school is. And one of the things we want to emphasize and have been emphasizing is to take a look at where you are in the particular area of the so-called opening America again.
Now, Minnesota is in phase 3 of that reopening, which allows schools to open in a hybrid model given CDC and Minnesota Department of Health guidelines. Those guidelines aren't clear just yet as they pertain to the fall. The CDC will release new comprehensive recommendations soon. The Minnesota's superintendents and chancellors will then build their plans off of that, which Dr. Fauci says should include things like testing, prevention, and a strategy on how to isolate students should need be. As for how this aligns with possible treatment timelines, the health leaders who testified are optimistic that treatments like remdesivir, for example, the only drug shown to speed the recovery process, will be available by this fall at a price, of course. Vaccines are a different story, Allie. The FDA used the words aspirationally hopeful that doses will be available early next year.
Okay, Christiane, live for us in the newsroom. Thank you. Testing continues to go up around the country, as does confirmed cases of COVID-19. The last 4 days have seen the largest increases in cases nationally since the start of the pandemic. More than 30 states, including Wisconsin, are experiencing a spike in cases. So far, that's not the case in Minnesota. For the first time since April, the state had 10 or fewer deaths each day for more than a week through Saturday. That streak has continued so far this week as well. Today, the Department of Health reported 6 more deaths and nearly 450 more cases. That brings the state totals to more than 36,000 cases. 31,000 people no longer need to be isolated.